Hey everybody, Dr. John Baird, board certified in anti-aging medicine and a functional endocrinologist. Thank you so much for your interest in thyroid disease. I've been treating thyroid for over 20 years and had fantastic success. Today I wanted to go over with you what the thyroid actually does and what we can do to help improve your thyroid function and improve your overall health. I wanted to have you look at this slide. Your thyroid supports bone metabolism, immune system, your brain and nervous system, gastrointestinal functioning, liver and gallbladder, your growth and sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol levels, and your proper stomach acid. So what does all this mean? Here's your thyroid right here, sits in your neck, right around your larynx, and your thyroid produces hormones that control all of these functions in your body. So we know that if your thyroid isn't balanced, you can have weakness of your bone called osteoporosis. You can feel sick all the time. You can have anxiety or sleeping disorders. You can have constipation. People who get their gallbladders taken out, a lot of times it's actually a thyroid problem. They don't know it. If your progesterone goes down, it's going to affect your thyroid functioning, which happens to women in their 40s. It controls your metabolism, so it helps you to be able to lose weight. And if you have prediabetes, we know that about 50% of people that have diabetes can have thyroid disease and vice versa. If your cholesterol is up, the main reason could be it's all your thyroid. And then if you don't have enough stomach acid, it can affect your thyroid as well. Let's go through the symptoms of low thyroid. First symptom is hair loss or thinning, tired or sluggish, probably the most common symptom I see in my practice. Bowel difficulties like constipation or irritable bowel syndrome. Depression that doesn't get better with medications especially. Morning headaches. Weight gain despite dieting, despite improving your diet or exercising. Cold hands and feet is the symptom that we see the most. We call it a positive handshake test. Hot flashes, if you're giving hot flashes, it usually means you have autoimmune thyroid and that you're having episodes of it going up and down. Mood swings, nervous or emotional symptoms. Insomnia. Night sweats, again, is usually secondary to if your thyroid's high. Okay, so what's going on here? What we find is that the norm for thyroid treatment is we just tell people to go on thyroid medications and they're fine, but that's an outdated model because we know that 90% of thyroid conditions are actually autoimmune. So let me show you how your thyroid works. So your thyroid starts in your brain. Your brain is in your hypothalamus, creates a hormone called thyroid releasing hormone that then goes to the pituitary and tells the pituitary to produce TSH. This stimulates thyroid peroxidase, which tells your body to create T4 and then convert that to T3. So when your body produces thyroid, most of it is produced in the T4 form, which there are no receptors in your body to actually activate that. What that means is the hormones work with a lock and key. If you have T4 in your system, there's no lock for that to work into. It has to convert to T3 to have that happen, okay? It does that in your liver and your digestive tract. If you're stressed and it converts it to T3, reverse T3 is inactive. So part of the problem is doing the lab testing. And the lab testing is a problem because TSH is the least sensitive test. And as long as we're using that, we're going to have a difficult time getting you better. So the normal data for TSH is between 0.3 and 5.7. And what they found is that there's a functional range or an ideal range, usually around 1 of a TSH for your thyroid. Okay? These are all the different types of thyroid that you can have. The most common being autoimmune disease. You can also have thyroid resistance, which is usually secondary to stress, and you can have primary or secondary. If you're on birth control pills, that alone can give you thyroid symptoms because it elevates the protein in your body that works for thyroid, okay? 90% of people that have thyroid disease, it's autoimmune, which means the body's attacking itself. you have Th1 and Th2 cells, and when they become imbalanced, what that leads to is an autoimmune condition, and that needs to be rebalanced for you to feel better. Okay? Now, most of you don't know about autoimmune disease, so I'm going to give you a quick primer. These are all the different autoimmune diseases that we have in our body, from multiple sclerosis to rheumatoid arthritis to Crohn's disease. All of these can be autoimmune diseases. Okay? So we want to make sure that whatever we do, we educate you on how the thyroid works and everything else. But definitely what we want is we want you to be able to get better. And the way to do that is to order the proper test. Okay? So what I'm going to do differently than most people is, once we know you have the symptoms, I'm going to check your test the correct way. I'm going to check your adrenals to make sure that you're not stressed, because that affects it. I'm going to check your female and male hormones to make sure that's okay. And then I'm going to also check your thyroid the correct way, including the antibodies. Once we look at all of those things, we'll sit down with a consult and we'll go over your individual case, and then we'll come up with a game plan to help you get better. If this sounds like it's right for you and you want to get your thyroid better, or at least be assessed to see if you have thyroid disease, please give our office a call, 502-785-7480. Schedule a consult with me, and we'll try to get this figured out for you. Have a great day. We'll talk to you soon.